Hello, everyone. Before we understand the placebo effect, let's first answer an important question. What is a placebo? A placebo is an inactive substance or treatment that has no specific pharmacological activity against the condition being treated. In other words, it contains no active ingredient that can directly treat the disease. Common examples of placebos include sugar tablets, saline injections, inert capsules, and even sham procedures or placebo surgeries. Now, if a placebo has no active drug, you might wonder, how can it make someone feel better? The answer lies in the remarkable power of the human brain. A placebo itself does not treat the disease. Instead, when a patient believes that the treatment will work, that expectation can trigger measurable physiological and psychological changes in the body. This leads us to an important concept known as the placebo effect. So, what is the placebo effect? The placebo effect is the beneficial improvement in symptoms or health outcomes that occurs after receiving an inactive treatment because the patient expects the treatment to be effective. In other words, the improvement does not occur because of the medicine itself. Instead, it results from the patient's belief, expectations, previous experiences, and the overall therapeutic environment. Let's understand this with a few simple examples. Imagine a patient with a headache who receives a sugar pill, believing it to be a powerful painkiller. About 30 minutes later, the headache improves. Since the pill contains no active drug, the relief is due to the placebo effect. Here's another example. A patient with mild anxiety takes an inactive tablet but believes it is an anti-anxiety medication. Soon, the patient reports feeling calmer and more relaxed. Similarly, patients with chronic pain may experience reduced pain intensity after receiving a saline injection that is presented as a potent pain-relieving medicine. These examples show that the placebo effect is a real biological response, not simply imagination. Now let's explore how the placebo effect works. The placebo effect involves several brain regions and neurotransmitters that influence how we perceive pain, emotions, and well-being. The first mechanism is positive expectation. When patients believe that a treatment will help, their anxiety decreases, hope increases, and the brain begins to anticipate recovery. These positive expectations activate neural circuits involved in controlling symptoms, preparing the body for improvement. The second mechanism involves endorphins. Positive expectations stimulate the release of endorphins, which are the body's natural opioid peptides. These chemicals help reduce pain, improve the sense of well-being, and decrease discomfort. This is one reason why placebo responses are especially strong in pain management. The third mechanism is dopamine release. Placebo treatment activates the brain's reward pathways, leading to the release of dopamine. Dopamine improves mood, increases motivation, enhances feelings of reward, and can even change how symptoms are perceived. Another important mechanism involves the activation of specific brain regions. Brain imaging studies have shown increased activity in areas such as the prefrontal cortex, anterior cingulate cortex, periaqueductal gray, and nucleus accumbens. Together, these regions regulate pain perception, emotional responses, reward processing, and decision-making, helping explain why placebo treatments can produce measurable physiological effects. Finally, there is conditioning. Over time, repeated successful treatments teach the brain to associate taking medicine with recovery. Eventually, even an inactive tablet can trigger a similar response because the brain has learned to expect improvement whenever medication is taken. Now let's look at the factors that influence the placebo effect. A stronger placebo response is more likely when there is a positive doctor-patient relationship, strong patient expectations, and previous successful treatment experiences. Confidence in the healthcare provider also plays an important role. Interestingly, studies have shown that treatments that appear more impressive, such as larger tablets, branded medications, or treatments perceived to be more expensive, can produce stronger placebo responses. In addition, warm, empathetic, and reassuring communication from healthcare professionals can significantly enhance the placebo effect. So, the key message is this: a placebo contains no active medication, but it can still produce real improvements because positive expectations activate complex biological processes in the brain. The placebo effect reminds us that a patient's beliefs, emotions, and the therapeutic environment can significantly influence treatment outcomes. Thank you for watching. If you found this video helpful, please like, share, and subscribe to the channel.